Is there now possibility of the next step on the roadmap, i.e. June 21st, this could now actually have to be put on ice? Mr. Zahawi.
So the real, the important thing to remember is that the 4 weeks plus one period was real and was deliberate. Why? Because it gives us enough time to collect the evidence, the data, as Chris Whitty described it in the sort of early press conference when we announced the roadmap, and then to be able to analyze it. So Monday is still on because obviously hospitalisation.
Sure, I realise that, but my eye is really looking a little further. I have to put it to you again. There is a possibility then that we might have to press pause as part of June 21.
And the way we don't have to do that is by everybody doing their bit by taking the two tests a week.
You didn't say no.
Your PCR tests in those areas and to isolate because we've got to break the cycle of infection, because one of those big tests was infection rates have to be suppressed, and the other big test is variants. If those cause us a problem, then the tests will fail. The four tests have to be met for the 21st of June. Today, we're announcing a surge testing program, 100 nurses, public health practitioners, environmental health practitioners going to Bolton and Formby, door-to-door knocking, a mobile testing unit for PCR tests. Please take advantage of those tests and get yourself tested. We've delivered 800,000 PCR tests around England to 15 areas where we are surge testing at scale, and then genome sequencing. And the most important bit, to add to what you've just said, which is to get your vaccine, is if you are found to be positive, please isolate immediately, because the way we break the cycle of infection of this variant is to make sure that we obviously test people, genome sequence, and then isolate. Isolate is the message if you are found to be positive.
Well, I'm back to what I'm saying to you again. The clinicians will make those sort of recommendations, those decisions, and we will flex the vaccination program accordingly, whether it be multi-generational households or the dosing interval between doses. We will do whatever it takes to try and make sure we deliver the vaccines that Bolton or Formby needs, or other parts of the country.